Hello, my name is Dr. Agnes Motes. I serve with Uganda Counseling and Support Services at Nana's Medical Center 3. Today I have come to share information about excessive bleeding after childbirth. Just in last year, above 1,000 mothers lost their lives after delivery. So you can imagine this is like a whole village or 2 to 3 villages of pregnant people that died just in last year. And in Busoga region alone, about 123 mothers lost their lives during labor and after delivery. A woman can bleed excessively after childbirth. If we are to quantify the blood, let's say if a woman has pushed and has lost more than a cup of blood, that is excessive bleeding after childbirth. Excessive bleeding after childbirth can occur when a mother has given birth and maybe they are retained products like the placenta can retain, they can be retained clothes that can cause a mother to bleed excessively after childbirth. It can also result from tears. A mother can sustain tears after delivery, can sustain cervical tears, perineal tears after delivery, which can cause the mother to bleed excessively after birth. And also when the uterus has carried very many children, it loses its ability to regain its original shape, or we call it elasticity. It can lose its elasticity and the ability to come back together after the baby comes out. So this also predisposes a woman to excessive bleeding after childbirth. It can also result from the body's inability to clot after an injury, or let us say having low platelet levels, which can also cause a mother to bleed excessively. Any pregnancy is a risk for excessive bleeding after childbirth. So as long as you are pregnant, know that you are at risk of excessively bleeding after childbirth, and therefore, as soon as you realize that you are pregnant, I advise that you seek medical attention in qualified hands. Yes, let us take our lives from traditional birth attendants. I know they have success stories, but your life is way greater than living it in the life of an unqualified person. So I would encourage mothers, as soon as you realize that you are pregnant, as early as you get to know that you are pregnant, please seek medical advice. Please go for antenatal early. It will help to identify risk factors that can predispose you to excessively bleed. And also, sometimes we delay on the way, the transit between home, between making the decision and coming to the health facility. Sometimes there are also delays. Sometimes it is not our making, but also preparing early, knowing that pregnancy is risk, and being prepared early that in case anything happens, this is what I can do to ensure that I reach the facility in time. So husbands and all men out there, I want you to take up this as an action to support your wives during the entire process of carrying the pregnancy and also childbirth. You being the heads of the households and sometimes the decision makers in most of the households, your role is, your voice is big enough. Your voice is so sound in helping women avoid excessively bleeding after childbirth by helping them to go for antenatal. When you go together with your wife during antenatal, we do what is called risk assessment, and you get first-hand information from the health worker that can help you as a decision maker in your household to plan early and also make the appropriate decision for your wife. So I encourage all men to be involved in the process of the entire pregnancy. As a priest or church leader or imam, you still have a role to play in this, in reducing excessive bleeding after childbirth. You can encourage the church members, you can encourage the people who come to the mosque to always seek medical attention in as much as we can be praying for them, but also seeking medical attention early enough, or is also going to help us to reduce excessive bleeding after childbirth. A mother is someone who gives life. Why should she lose her life in the process of giving life? Together we can help these mothers, and they also live to see the lives they bring on earth. Thank you so very much.